Hi, Claudia. Good evening.
Good evening, teacher.
How are you? How
I'm
is
fine. Oh, it's very cold.
Argentina? Yes,
Yeah, it's very cold.
that's why
But
it's cold here.
yeah, it's like the weather of La Paz. I think the
Yeah,
same.
yeah. I've heard that the frozen weather comes from Argentina, from La Patagonia, Argentina.
Really? I know that.
Yes, but I don't know. Maybe that frozen weather in Tarija, but I don't know here where it's so cold. What happened with La
In
Paz?
La Paz is colder.
Yes, it's really cold. Where do you live?
In La Paz, I live in
Oh,
Obrajes.
okay. I live in your Pavi, but it's cold here too. When I mean, in the night, it's so cold, and the wind.
Oh, that's too bad. Well, here is the same.
Yes. Okay, Cloud. Let's talk about some other topics that we were talking about last few days. Mm, maybe what what kind of questions would you ask if you are suspecting about a patient with some problem with the urinary system?
Okay. I would ask if the person maybe presents fever. Also, if presents dysuria, I will ask the frequency that the person goes to the bathroom to urinate. Also, if the color of the urine it's red or yellow or is white, I don't know. Or also I can ask if a person presents nocturia, if he or she goes maybe 2, 3, or 4 times at night to urinate. Also, especially women after 45 years old, if she presents maybe dribbling. Another important symptom is if the person presents pain on the lumbar spine to that level. So it's a strange, but it's a good sign. I think that's all, teacher.
Why is that? Why is that it's a good sign?
No, it's a good sign if, for example, the patient presents urinary infection, but if the person presents pain on the spine at the level of the lumbar area, it's associated to pyelonephritis. So that's I think it's a red sign that the infection would be more
On the
more in the
kidneys, upper.
kidneys. Yeah, upper.
Okay, I understand now. Okay, so in that case, you will send it to the specialist, right?
Yeah, for sure, because maybe the person presents or would need an ultrasound or a TC,
Okay.
computerized tomography. Yeah, to to make sure that is not the infection on the kidneys.
Okay. And I was curious. Well, as an anesthesiologist, what type of examinations do you do, or you just go to the operating room and do your job? How is your
No,
work?
well, we usually make the pre-anesthetic visit to all the patients, and we ask about if they have some diseases, or they have any surgery before, if they have any surgery before, if they have any trouble with the anesthesia. Also, if they present allergies. Some of the patients, for example, had surgeries before, and they say that it was very difficult to intubate if the anesthesiologist telling them. So that's a red flag for us. We have to be ready with all the equipment for the difficult airway to intubate that patient. No.
Mhm.
Also, if they present some allergies, that it's very common, or and the fast hours, it's very important, because the patient couldn't have the surgery with a filled stomach. So I think that's the most important parameters that we take.
Okay.
And it depends of the diseases, of the problems that they have, and before, and other anesthesia procedures that they had before, we can plan or do a better planification of or anesthesia techniques, because in every patient it's very different. Also with the weight, the age,
Mhm.
the gender. So we see maybe all the kind of medicine, the internal medicine, into the surgical problems. Also, we have to take present the type of surgery that they have, if the surgery needs or has so many changes of the blood pressure, of the heart frequency. For example, in ocular surgeries, they usually push the ocular glove, so they present a lot of bradycardia, and it's
Mhm.
it's very risky if you don't pay attention of that moment of the surgery, because the patient can present a heart attack at that moment on the surgery. Or some surgeries, for example, the hip surgeries that presents so many bleeding at the time, or present the moment of the make, for example, a hip replacement. There's a moment, well, they put a kind of cement,
Yeah.
and the patient can present a bigger allergic reaction for that
Mhm.
substance. And also, as a normal reaction, they present a very low blood pressure in that moment of the surgery. That's why it's very important to have a regular or a high level of the blood pressure for that moment of the surgery.
Okay.
Yeah. After that, if we
We
do
did it.
general anesthesia or regional anesthesia, we have to make a good control of the pain management after the surgery. We check the patients until they're very awake, with vital signs very stable,
Mhm.
to send them to their own rooms. Because sometimes with anesthesia, there's something named recirculation with some drugs, and the patient could sleep again with anesthesia. And that's very dangerous, because they could sleep meanwhile they are maybe eating or drinking something, and they can have an bronchoaspiration, for example. Also, is risky in some patients because if we have the recirculation with some drugs, they also can present apnea. And if you don't have oxygen to manage the airway, the patient could die easily. So it's very, it's a very risky specialty.
Yes,
But you have to remember.
but you like it.
Yeah, for sure. I love to give anesthesia. I stress a lot with so many patients, and
I feel that
yeah, with my
it's a
colleagues, we
lot of
say that
responsibility for you.
yeah. But as we say with our colleagues, well, everybody can give anesthesia, and most of the time it goes well. But the most important thing is to identify the complications and have a good knowledge to solve them.
Mhm.
That's the most important, because you always will have
Yes.
complications, no? And the surgical complication needs a faster answer to the difference with clinic specialties. They don't have emergencies, they don't have so many risky.
Yes,
But
that's right.
that
You
but
have to
they
be
will less
in
they will
control
less
of yourself.
yeah. But clinic specialties win less money than us, so I think it's good for us.
Yeah, but it's a lot. You should receive more than than the other ones.
Yeah, so we earn more money, but it's more risk, it's more stressful, but it's not for everybody.
And not every time, right? Maybe
Yeah,
just one or two surgeries, or maybe how many
no,
surgeries do you have per day?
the last Saturday I did 6 surgeries, for example. I have
And they were
nights when
different.
I do 10 surgeries where the surgeon is faster. So
So you, sorry, continue. We have a little delay here.
yeah. And some days I just have maybe 1 or 2 surgeries. So. But sometimes one surgery takes maybe 6 hours, like a spine surgery, for example, or a brain surgery, 6 to 10 hours easily.
Wow. And you work in a lot of hospitals, or you have just a few places? I think they call you to work with them,
Yeah.
or how is it?
I work now. I'm with 2 clinics working
Mhm.
privately, and I'm doing private practices now because I'm trying to study to do the specialty at the United States. That's why I'm taking this course too. So that's my goal,
Okay.
I think, to fly away.
Okay, you are one of the best. You have the knowledge, you are under control, you are patient. I think you have a lot of abilities for sure. So you will do
Uh,
it, Claudia.
th-
Don't worry.
okay, thank you so much, teacher.
Thank you, Claudia. Okay, that's all. It was interesting talking to you today, and see you on Monday, okay?
Okay, teacher, bye.
Take care.
Good
Have
night.
fun. Bye bye.
You too.
Thank you. Hi, Valeria. Good evening.
Hi, good evening.
Okay. Hi. Nice to meet you.
Hi, nice to meet you too.
Okay. Where are you from, Valeria?
I'm from El Salvador.
I'm
El
sorry.
Salvador? El
El
Salvador, I'm
Salvador.
sorry. It's raining over here, so I have like a little bit bad connection.
Okay. No worries. We have a little delay, but we have to be patient. Okay.
Mhm.
Well, Valeria. Um, well, since we don't have the chance to talk yesterday, and maybe you can mention what type of rashes are common in El Salvador.
What time of what?
What type of rashes are common in El Salvador?
Mm,
Do you understand the question? Did you have the chance to watch the class, yesterday's class?
no.
Okay.
Pero what, I mean, I don't know what rashes is, right? Pero like what type, I don't know.
Okay, no worries. I will explain to you.
Mhm.
Random type of lesions that appear on your skin, on the surface of your skin. They could be papules, macules, they could be vesicles, and it could be they could be caused by allergies. That I will be maybe herpes or
You are free.
chickenpox. Other
Hi, Vale, can you listen to me now?
Yes.
Oh, I'm sorry, I don't know. It was my signal.
Ah, I
was
thought it
bad
was mine, pero
Yes, I don't know what's happened. Maybe the wind. Okay, we have a few minutes, but I don't know if you could understand what I was saying about the rashes.
yeah, that there are different type of rashes, right? Like for the
Yeah.
skin.
Yes. And since that definition, what type of rashes? Hi, Vale.
Hi. I can't listen you. Hi. Okay. You're mute. I can't hear you. Your microphone is off.
Okay.
Uh-huh.
Okay. So, what type of rashes are common in your country?
Maybe like mm, most of the rashes are like for food potion or food reaction in the skin, or maybe burns. I don't know how, maybe.
Okay.
I don't know what other type of rash.
Okay. Maybe can you describe a rash for allergies? That's the most common one, I think, in everywhere.
Yeah. Wait, excuse. Sorry. So food allergies for food poisoning, right?
Yeah,
Like
could be.
there are many different types, maybe like small pin dots on your skin.
Mhm.
And sometimes they hurt or they just itch.
Okay. Okay. And what are the signs that appear first in that kind of condition?
Maybe dizziness, headaches, maybe diarrhea, um, vomits and obviously the rash on your skin.
Okay. Okay. I don't know, but I hear someone is helping you or something.
Yeah, my little sister is here.
Okay. No worries. This class is to practice. So you have to be really focused, okay, in what we
Yeah,
are talking.
yeah.
No worries if you don't know maybe some definition or I don't know, or you forgot something, you can always describe or ask and we
Okay.
can find out. We are here to learn, okay?
Mhm.
So, well, I think you can describe maybe, I don't know if you have there in El Salvador chicken pox.
What is it called in Spanish?
Varicela.
Yeah, we do,
Okay.
but it's also if we get the vaccine, it's very rare that
Okay.
we can get that.
Yes, I know. But can you give me the signs maybe or the symptoms? But we don't have enough time this time. I owe you 10 minutes. Okay? And we will make it another time, but maybe we can schedule it
Okay.
for another day. I will
Yes.
send to you my questionnaire, please. If you
Okay.
can feel it, I don't know if you can see it.
Yes.
Okay.
Okay. So this is it, right?
Yes, this is it. This is just the practice, 15
And
minutes. And then
tomorrow
on
we
Monday,
will
we're going to have the theoretical
the
class.
Okay.
Yes.
Okay, perfect.
Okay, thank you so much. And
Thank
see you
you.
on Monday at 8 Bolivian hour, please.
Okay, okay. It will be mine 6.
Yes. Okay, thank
Okay,
you. Take
perfect.
care.
Take care.
Bye-bye.
Bye.
Hi, Mateo. Good evening.
Hi, teacher. Good evening.
How are you?
Fine. How are you?
Okay, Mateo.
Hmm.
We were talking about some diseases or some conditions like I don't know, something with urinary system, right? Which
Yeah.
are the questions that you will make to your patient if you are suspecting of any kind of condition?
Okay. First of all, I should ask how many times he's going to the bathroom to urinate, the volume of the urination, and the color, if there is pain or there is not. And in some types of diseases, I would ask how much water the patient ingests.
Mm-hmm.
But the first questions are pretty much it. If the patient has any urine leakage or dribbling, or if he has difficulty on the urination, if he's satisfied with the volume and his urination behavior, and it depends on that. We can go on with the questionnaire.
Okay. Okay. And I know you are not a specialist, but maybe you would suggest any laboratory test or
Okay.
send to another place. I don't know.
No, I think this is the common laboratory test that we should prescribe to most of the patients. If urine general exam
Mhm.
or general exam of urine. I don't know. I don't remember how it's in English. And
Urinalysis.
urinalysis. Yeah.
Yes.
Thank you.
Mhm.
Sorry,
No
I
problem.
forgot the urinalysis, and of course an hemogram and and blood chemistry to analyze if there's another condition that is causing some urination disturbances or not. And the urinalysis it depends, the urinalysis should reveal most of the pathologies and some microscopic analysis of urine too. If there's red blood cells or red blood cells casts or leukocytes casts and that type of findings.
Okay, perfect. And what kind of treatment would you suggest to your patient?
It depends on the condition, but the most common urinary conditions are the infections.
Mhm.
So an antibiotic, like I don't remember the name of the antibiotic right now. Oh,
No worries. In general.
yeah, it's amoxicillin and clavulanic acid. That's like the first, like the gold standard for most of urination or urine tract infections.
Okay. And any other suggests for your patients besides these antibiotics?
Yeah, they um, they can start drinking more water, drinking less sodas, eating less salt, and that's pretty much it. Yeah, maybe some eating more. What is this? Blackberries or blackberry concentration.
That helps?
Yeah. In fact, the blackberry has a compound that is the precursor of one antibiotic that only that excretes completely by the kidney. So it's very very common in the utilization for urine tract infections. That's an antibiotic I wanted to mention before, but I don't remember. It starts with N. It's really common for
Nitrofurantoin?
yeah. That's that
Okay.
nitrofurantoin. Yeah.
Yeah. Okay, that's interesting. I didn't know the blackberries were.
Yeah, it helps. It helps.
Does
It's
help.
not a curative or as efficient as medications, but it helps a lot.
Okay, that's really good. Okay, perfect. And
No, sorry, it was blueberries. The blackberries are the with the
BlackBerry is
blackberries
not
are,
the cell phone.
yeah, no, blackberries is that fruit with a lot of bubbles, right?
Yeah,
And
blueberries are.
blueberries are just one,
What is
yeah,
the name
just
in
one liter.
Spanish?
Arándano.
Arándano.
Blueberries then. Blueberries, not blackberries. Blueberries.
Okay. Okay, got it. And the last thing, last question is, what do you do when you have a patient? You have to diagnose. I
Mhm.
want to know the procedure of the examination or the
You know,
protocol you follow.
for an examination of the urinate tract.
You can choose any kind of condition.
Okay, for the examination, first of all is to watch and seek to watch, right? Some lesions, irregularities, lumps, or other thing. That's part of the inspection. Then you can here make the auscultation in the abdomen or in other parts of the body, the palpation and percussion, and that's pretty much it. But I would like to yeah, that's pretty much it. In the abdomen, it's first the auscultation. After the inspection, the auscultation, and then palpation and percussion. And in the rest of the body is palpation, percussion, and the final step is auscultation.
Okay, imagine your patient has an accident.
Okay.
How would be the management of this?
First of all, we have to evaluate the consciousness state of the patient. If he has a response to verbal instructions, and if the patient doesn't have this response, we have to start the ABC. I think that it's a little change nowadays, but with the ABC, we have to check the airways. The airway, if the airway is permeable or not. Have evaluate if the patient is breathing or not, and the circulation. We have to check the pulses of the patient. If it has not a pulse, we must initiate resuscitation. And it depends of the case. We can administer some drugs and stabilize the patient. If there's a bleeding, an external bleeding, we can seek the way of contain this bleeding, so the patient stops bleeding and stops losing blood. That would be really helpful for the stabilization of the patient. And if we have the appropriate implements, we should seek an intravenous access to administer fluids, drugs, and help the stabilize the patient.
Okay. Okay. In case you have a trouble with the lung, maybe
Okay.
and I don't know, any type of trouble, what would you do with that? What is the procedure?
So if it's an accident, imagine a car accident, like I'm imagining previously. We have to think that the patient probably broke a rib, and the rib perforated the lung, and this perforation causes a pneumothorax. The pneumothorax comprimes that lung, and the lung is very, very little, and the thoracic cavity is full of air. So we have to decompress that air, and help that air exit with a trocar. We have to stab the patient, or stab in the second intercostal space, in the midline, in the mid clavicular line,
Mhm.
and this function will help the air to go off the thoracic cavity, to help expand again the lung.
Okay, and then you should send him to the hospital.
Yeah. So the surgeons can repair that injury.
Okay, Mateo, that was good. Thank you so much. I will send to you my questionnaire, please.
Okay.
Okay, maybe you can see it now.
Yeah.
Please fill it for me.
Okay. Already filled.
Thank you so much. And see you on Monday, okay?
Okay. Bye, teacher. See you on Monday.
Okay,
Good
take care.
Good night.
Have a good weekend. Bye-bye.
You too. Bye.
Bye. Hi, Melanie. Good evening. Oh, sorry. Can
Hi,
you
Miss.
listen to me? Oh, now you can.
Yes. Now, yes.
Okay. How is everything?
Good. I have a lot of work, but all totally. All is good.
Okay, you're working now, or you have classes? I'm sorry, I
I'm
want to know. I'm
working.
curious about that.
Yes, I have work, but in the night. I'm started 8 o'clock here in Peru, and
Mhm.
I finish in the midnight.
Okay. Okay, I understand now. Well, let's start. Continuing with the second part, I want to know maybe which type of questions would you make to your patient that you're suspecting he has it's me again. I'm sorry.
Recording in progress.
I will.
Okay, you're watching me.
Yes. A change of camera.
Yeah, I'm so sorry. Okay, I'm gonna get out.
I hear part of the question about question.
Yes, which type of questions would you make to your patient? Maybe you think your patient has some urinary system problems, and you want to find out to make a diagnosis.
What kind of, sorry, I can listen the last part of the question. Diagnosis about what, or what? to what is my suspicion, my diagnosis suspicion.
Okay, you're suspecting that your patient has
I think
urinary
that
trouble.
it's the internet is not good today.
Oh no, what is going
I
on?
I
Yes, I cannot. Oh,
it's okay.
okay. I will.
You can listen to me now? I don't know.
Listen to you now. Can you?
Yes, I
Okay.
think that it's good.
Okay. I hope we won't have problems anymore. I was telling you that you imagine that you have a patient and you're suspecting that he or she has any urinary system problems. So you will ask any questions to get farther, okay, to go farther. And what type of questions would you make?
Okay, I can ask, for example, if the patient have, do you have pain when you pass water, or maybe have you noticed blood in your pee, no, when you have a mixture, maybe did you have something abnormal in your pee, for example, the color is different, or maybe have you smell something weird maybe when you're in the bathroom, or in some cases, if have you noticed that in your pee are bubbles, burbujas, in some cases, for example, or maybe have you noticed that you have a problem to start the pass the water.
Mhm.
What else? Maybe if the patient is more thirsty, maybe, I don't know.
Yeah? Okay.
More questions?
No, it's okay. It's okay. So, okay, you found out that your patient, yes, indeed, has these kind of troubles. So,
Okay.
what type of treatment would you suggest to them?
Well, before the treatment, I think that I can first search the exam, no, the analysis about the urine, and if it's may, for example, have an infection, the treatment is antibiotic, a specific antibiotic. In the some well, in the majority of the cases, the most common bacteria is the E. coli. So, for example, I can prescribes, I don't know, nitrofurantoin, or maybe other antibiotic, the amoxicillin, or any. Well, I don't remember some of the medication, but it's not only the medication; it's the diet too. The patient has to drink more water. In my personal fact, I know that the cranberries is very help a lot in these cases. Don't maybe if, for example, it's a woman, I can suggest how what is the better way to clean when she's in the bathroom, not to I don't know, de adelante para atrás. I don't know how to say it.
Back, no, forward to back.
Yes, something had just something to that, for because in the woman the anus is very close with the
Okay,
ureter.
you mean with the
So
cleaning of the zone?
yes, yes, I have for the hygienic method, no, in the patient, or use clothes not very tight, no, more more suelto, more bigger. I don't know.
That's cool. Yeah.
Mhm. And well, that I think that is the treatment, no? The medication and the diet and the hygiene method, no, in the patient.
Okay, perfect. And well, since we were talking about some tests, what type of test would you send her or her in this case to make?
I remember that it's very important do, for example, the urine when urine cultive or urine culture, the urocultivo.
Yes.
It's important that this exam is before the medication. So don't it's important don't alter this exam. In this type of analysis, we can found the specific bacteria and they include if we uh, prescribe the antiviral. I think the
Antiviral?
antiviral. We can found which is the medication resist or sensitive for this case. Other exam is the urine analysis or the urine analysis.
Urinalysis.
Urinalysis. And to know if the patient have infection and how much or what is the level of infection. If it's several or maybe it is I know that we can found the cruz if one, two, or three. I don't know how to say cruz or like
Cross.
cross. It depends of the infection, and we can found in this exam black, no, white cells or different cells that we can have the better diagnosis, no, in this infection.
Okay, perfect.
Oh, it's I can hear you, Miss. It's
You follow. Can you listen to me?
Yes, but now no, I don't listen the question before.
No
Yes.
worries. I was telling you that I know you work with patients all day, so you have to make examinations, and I want to know the protocol you follow of those examinations. You can choose any type of condition and describe for me the examination.
Okay. It's very common in the consultor. For example, first the patient have seat and we have a conversation about the anamnesis. No, we ask about the what's an or bueno, we can ask about what kind of painful she or he or she have, what is the symptom and the sign that is in I don't the reason to the patient come, no? For example, if the patient in general have a history, they tell us how all start, the causes, and finally, if we with the anamnesis we have a lot of information that is very important to have an idea. For example, in the when the patient having a urine infection, it's all related with the urine that is the most in focus in that, the change in the urine, in the physical examination, we in focus in the abdomen and the back too. We percute the kidneys, and we can, in the inspection, we can see if the abdomen is more bigger, or maybe have some change in the in that part of the body, or oh, I think that my alarm, sorry. And we, and after the physical examination, we prescribe the exam, and it's the most common in the consultor, because in emergency it's very different, because we don't have a conversation. We the first step is check the vital sign, and we prescribe the exam immediately, because it's an emergency. So depend of the cases. No? Miss, you're in mute, I think, because I can see you, but I see the yes.
I'm so sorry. I was talking to myself. Okay. It was good. I will send to you my questionnaire. And
Okay.
just one thing, when we are talking about the place where we are working, we talk about consultation. Okay.
Consultation. See, yes.
Sometimes we forgot and make this confusion. But
Okay.
consultation. Okay. And that's really good. I will let you rest and work. You know, you're busy. Just one picture more, and see you on Monday, okay?
Okay, Miss. Thank you so much.
Thank you. Thank
See
you.
you. Bye.
Bye-bye. Hi, Carlita. Good evening.
Good evening, Miss.
Lisa, we're ready.
Sorry?
Okay. Okay, we're ready. We're ready now. Carlita, imagine you have a patient that you are suspicious she has some troubles with the urinary system. So which type of questions would you make to go further?
Well, if I will ask if, if I have the patient in front of me, I would ask if do you have a discomfort will be when you urinate, or as we saw yesterday was burning. I don't remember the name. Ardor al orinar.
Burning.
Burning, that's correct. Yes. And how often do you go to the bathroom to urinate? And if you go frequently in the nights, I think that if we well, I will ask what problem more does she have? I think that, and it depends.
How often do you go to the
what
bathroom?
if she have discomfort to urinate, or what was the word? Ardor, mucho.
The word,
Es
if
que
you don't remember. You can describe the word if you don't remember.
burning, as you said. Ardor.
Burning.
Yes, burning.
Okay.
And how frequency when I don't know what else. If um, if if she thinks that she lost the control of her bladder, could be. And yes, I think that, and I will check the patient.
Okay. Okay, that's good. And maybe you have to send her to make some tests. What type of test would you suggest?
The first test I would suggest is a general exam of urine. Correct? It's the first to know if there are there is an infection. We can see in this test the leukocytosis. I don't remember.
Okay.
We can see, yes. Also, it depends. We can difference the an infection, urine infection, in urine infection high and low, and we can different this with symptoms and with the test also. In the test, in an high infection, we can see the difference with the low infection is the cylindros. We can see cylindros in the ego, well, in
On the
the
test?
abbreviation. Excuse me? Yes,
Test?
sí, the abbreviation in Spanish is ego, examen general de orina, sorry.
Okay. Remember in English, urinalysis?
Yes, urinalysis. Yes, and it depends. Also, we can use urocultivo. Urocultivo, but it's going to need more time to have the results. So the first test that we can do is the urinalysis. Is that correct?
Yes, it's correct. Urinalysis. Perfect. Okay. And well, you already know that your patient has some trouble. What type of treatment would you suggest to her?
Well, the urine infection are most of the are caused by microorganisms. Most common is bacteria.
Yeah.
Yes, the most common is Escherichia coli, so we can use antibiotics. And treatment, symptomatic treatment could be.
Symptomatic treatment?
Yes. Also
Yes.
to the pain, and it depends if the patient have a, as I said, a low infection or a high infection. If she have a high infection, she have to be internal. Yes. And if she have a low infection, we can use only the antibiotic. I recommend the patient to drink much water and the symptomatic.
Okay.
Yes. Yes, I think that. About
Okay.
About infection, during infection we can different those types of infection, high and low. We can do the, well, in Spanish is signo de Giordano. I was Jordan. I don't remember the name.
It's that name, Giordano sign.
Giordano sign, yes. It is also named in Spanish, puño percusión. We can,
You can make a percussion.
yes, puño percusión se llama, in the low back. If the patient have a pain, we can see, we can different that is a high infection. And also, I don't know what to say, ureteral points, maybe, puntos ureterales.
Yes, ureterals, ureteral points.
Yes, ureteral points that will be high, in the middle, and low. If the patient have those ureteral points positive, it's an high infection. So we have to intern the patient. And it depends.
Okay, and besides the antibiotics or another treatment, another pharmacologic treatment, what else can you suggest to your patients?
Well, as I said, first drink a lot of water. But this also recommends like to be careful with the hygiene. How can I say that?
She has to be careful with the hygiene.
With hiding.
Hygiene.
Hygiene, and also most of the urine infection is caused by a sexual relation. It's most common in patients that have their sexual life.
Okay.
So we have to recommend those tips.
Okay,
Yes,
that's good. You can make any suggestions that you think that are important for the patient.
Yes. Yes.
Okay, that's good. If you want to add something else, or that's all?
I think that is the most important. I don't know. Right now, I can't think about more.
Okay, no worries. I have the last question here, and it is related with any type of condition you want, but I want to know how would you make an examination of this condition?
Urine system?
No, you can choose anyone, any type of condition you want.
Examination, well, it
Complete examination.
Okay, it begins since the patient entered to the door. We have to see the patient or what, how the patient works, how is her pieces, sus facies.
Okay.
She or he has pain, and well, after that we ask, and we can. It depends. For example, in intestinal infection, we have to auscultate first, first than palpate, because if we palpate first or percutimos, we can. I don't. We can confuse or alterar. We can alter the.
Can alterate.
Yes, los ruidos hidroaéreos. I don't
Those
know. Ruidos hidroaéreos.
Hidroaéreos.
Hidroaéreos. Ruidos hidroaéreos. We can alterate if we palpate or percute first in this system, but in other system we can do we can follow the the same la misma, I don't know how to say, the same, la misma secuencia.
The same sequence.
Yeah, sorry, the same sequencing when inspection, palpation, percussion, and auscultation. Yes, we can see that, and it depends what is the reason that the patient goes. We can see that.
Okay, I'm not listening very well.
I'm not sure if it's my internet.
Mine for sure, but I don't know if yours help helping mine. Okay. Or the word hydro air noises. Okay,
Hydro air noises.
noises. Yeah. Okay, Carlita, that was good. And I will send to you my questionnaire. Okay.
Okay.
I don't know if you can see it.
Yes.
Perfect. And one last picture. Okay. Thank you so much, Carlita, and see you on Monday, okay? At
Thank
8.
you. Okay. See you Monday.
You take care. Bye-bye.
Bye.
Bye. Hey, Jethro. Good evening.
Good evening, teacher.
Okay, I think I'm having some trouble with my internet, so let's just be patient, okay?
Okay, teacher.
Okay, thank you. Jethro, imagine you have a patient and you're suspicious because she has some signs and symptoms that makes you think she has some urinary system troubles. Which would be the questions that you would ask to go farther?
Okay. And the patient have an urine infection. Okay, maybe I could ask to my patient if he have maybe go to the bathroom more than times than usual, maybe more in the night. And I think this is the first question. Maybe another question could be if dysuria, but I can say dysuria to my patient.
Yes.
Yeah, but he don't understand, right? Because it's my patient. I can say you have dysuria. It's like, okay, is or do you have burning or any discomfort when urinating, maybe in the day? And
Mhm.
I think this is the more important question in this disease. Maybe I could ask to have you ever had urinary tract infection? Maybe. Um, and if so, how many times? Maybe.
Mhm.
What else? Um, I think that is my question, teacher.
Okay. And maybe yes, she has this affection. So what type of test would you suggest to her
Okay,
to make sure you're diagnosed?
I have doubt with this pronunciation. Is dysuria? Dysuria? Or how is the pronunciation in English?
Dysuria, it's okay.
Dysuria?
Dysuria.
Okay, okay, thanks. Maybe I could order a general urinalysis
Mhm.
in this condition, and to see if there are I don't know how to say in English, piocitos, pyocytes, piocitos,
Pyocytes.
pyocytes, white blood cells, and maybe blood in the urine. And maybe I could ask to I don't know how to say in English, urocultivo.
Um, you can say I'm not sure. The translation says that is urine culture test,
Urine culture.
but I'm not sure. Maybe urinalysis, like we learned in last class, remember?
Yes, 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 teacher. But I understand that is examen general de orina, right?
Yes.
But another test is urocultivo too. It's different.
Okay. Okay. We will find it out. Okay. I want to make sure that I'm telling you the truth. I don't know if it's the correct translation, but I will tell you.
Okay.
Okay, on Monday or on the next class. But let me make me remind, please.
Okay, teacher. I think this one, and maybe a complete blood count, right? And whatever. The the first time I all the tests.
Okay. And you're completely sure she has this trouble because of the test you sent her to take, right? And now, what type of treatment would you suggest to her?
Okay, it depends. Depends on the test. Like your contigo depends on this. And the more of cases, the bacteria more common in these cases, and there is this infection is Escherichia coli, right? And we know that. And uh, I suggest to my patient. Oh no, I don't suggest. It's like I tell my patient she needs, sorry, antibiotics.
Antibiotics.
Antibiotics, sorry.
Hmm?
Antibiotics. And this one is the principle. Maybe another recommendations like you have to drink a lot of water and maybe drink orange juice, lemon.
Mhm.
It's gonna help you a lot. But the principle is the antibiotics. Like I don't know how to say in English, nitrofurantoina.
Nitrofurantoin.
chlorphentoin, and maybe if this bacteria resistant for antibiotics, maybe it's cephalosporin. I don't know,
Yes, cephalosporin.
maybe I could use this antibiotic.
Okay. Okay, that's good. Okay, Jethro, that was good. And now I know you watch patients all day, where you work or where you study. So what kind of examination would you make? You can choose any type of condition you want, but make a complete examination and describe it for me, please.
Okay, maybe like a urine infection, right?
If you want, you can choose anyone.
Okay.
Any.
In order, it's like inspection, right? Inspection. There's one. In the first, I will put my patient on the camilla, stretcher, or
Stretcher.
that's right?
Yeah.
Camilla.
Yes.
Okay, and a stretcher, and I put my patient on the section. I could see my patient have he have oh my goodness, no sé la palabra. Sweat es sudoroso, ¿no? Si está sudando.
Sweaty.
Sweaty. Y have, I don't know how to say in English, como una fase álgida, se dice fase doloroso, o sea que viene como una cara con dolor, se dice, no en English.
In this case, facies we can translate as faces. And you can say pain faces.
Pain faces? Okay. Okay, maybe if she have the pain faces. This in the inspection, right? If we
Or sorry, Jethro, or painful faces in this case.
oh, okay, painful.
It's better.
Okay. Thank you, teacher. Yeah, she have painful faces. This in the inspection, if he comes to the room, ¿cómo se me fue la palabra? It's like, okay, maybe in the inspection this, and maybe in the inspection. Okay, I got it. Maybe in this condition, the first one I can see to my patient is the abdomen, right? And this is the more important. Like, okay, and in the abdomen, I can see in the inspection if he have any, maybe, I don't know, he have her hand in the stomach, like it's very painful for her, maybe. Como que tiene la mano en el estómago, agarrándose.
She's grabbing her stomach.
Okay, yes, he's grabbing his stomach and another, and inspection, percussion. I don't know if I found something in the percussion. Look what maybe in the palpation, I can check the abdomen if there are positive urethral points, right?
Yes.
And positive, I don't know how to say in English, puño percusión. Puño percusión.
Positive. Puño?
Se llama puño percusión.
Okay. You can make percussion. Puño percusión. I'm looking forward. Okay, go ahead.
Okay, I think. And maybe in the palpation, I can see this. And I think this is the more important examination in this disease.
Okay. Okay, okay, that's good. I will send to you my questionnaire. Well, while I'm looking for puño percusión. Okay. Okay. Hmm. I don't know. Fist percussion?
Fist?
Yes. I'm gonna write it. And what was the other word?
Urocultivo.
Yes. Thank you. Okay, Jethro. Thank you so much. I'm gonna take a picture and I will let you rest for the rest of the week.
Okay.
Okay, one more and see you on Monday, okay?
Okay, teacher.
But it will also be your homework to look forward these words. Okay? And we will find out which one has the best option to make sure that we're talking about the same word, okay?
Okay, teacher. Thanks.
Okay. Thank you, Jethro. Take care. Have a great weekend. Bye-bye.
Bye.
Hi, Jorge. Good evening. Hello.
Hello, good evening.
Good evening. Jorge, can you listen to me?
Yes.
Okay. Okay. I think I've been having some trouble with my internet. I don't know why.
Oh, it happens.
Maybe the
No
wind,
problem.
but I hope it won't happen anymore.
Okay, perfect.
Okay. Jorge, can you imagine you have a patient that has, well, you're suspicious that she has some urinary troubles.
Okay.
Okay. So which type of questions would you make to her?
Okay, perfect. First, I would ask for how her waterworks are going on. If she's passing urine well, if she has pain when passing urine. Also, I would ask for if she feels pain around the genital area. I would ask for also if she has some lesions that she can see on her skin, if the lesions are itching. Also, I would ask for sexual intercourse, and I think that would be like enough to make a diagnosis. Just asking questions, you know.
Okay, yes, it's pretty complete. And well, to make sure that your questions were well answered and you're thinking that she has this trouble, what type of test would you suggest to her?
Well, always I would ask for maybe complete hemogram, blood count, and due to know if there are some infections. I would also ask for maybe I don't know if in English it's Papa Nicolau 2. I think so, right?
Yes, it's the
Yeah.
same.
So it's really important to have the pap test. That it must be actual for each year. If she has already begun her sexual intercourse, I think it must be something really important. Yeah, I think it would be like very like guided, just for a general diagnosis. Yeah, I think that would be enough.
Okay. And well, another people mention urinalysis.
Oh, true. Yeah, I was forgetting that. Yeah, that would be very important. So that can guide us if there is an urinary infection more than a genital infection. That's true. Yeah, I was forgetting that.
Okay. And the other one that I thought it was the same, but no. um, I don't know if it's the same because the translation told me that is urocultivo in Spanish, but in English, uroculture or something like that.
Maybe culture,
Yes.
urine culture,
Yes.
something like that. Yeah, yeah. I don't
Yes.
think it would be
But
the
I'm not
same.
sure
I don't
that
think
it's
it would be
right.
the same. Yeah, I never heard it because I'm more focused on neurology and that stuff. But yeah, that must be a cultive, urine cultive, I think. Urine
Yes,
culture,
I
sorry,
was
sorry,
thinking the
urine culture,
same.
yeah. So yeah, it must be important to, if you think about a urinary infection, yeah, I think so.
Okay, perfect. And well, you already know that your patient has, and you're sure that she has this trouble. Well, what type of treatment would you suggest to her?
Well, if it's an infection, I think most urinary infections work well with ciprofloxacin. It's a great great antibiotic. I think that's the pronunciation. Or no, there is something.
Antibiotic.
Yeah, there's something. When I was working there, there is, say, for example, with some anti somethings. These are, for example, antidiuretic, not anti. And antibiotic, yes, is well said antibiotic, but different with anti something or antispasmodic. I don't
Yes,
understand American
I
people
don't
sometimes.
know. Yes, maybe because of the region. Yeah,
Yeah, yeah,
maybe
true.
it's like that. Like here, we have Canvas, Collas, and we
Yeah,
talk
that's true. Yeah.
like different. I think it's just because of that.
Yeah, for example, also pronouncing either or either is the same,
Yes, I know.
but I don't know, they have trouble with that. Well, getting back with the treatment, I would suggest the patient to take ciprofloxacin. Also, nitrofurantoin is a good option too, and yeah, to keep the area really clean is also important. Not with soap because the pH changes a lot, and it's really important to maintain the pH, um, an acid pH, so it's not that it doesn't have like too many troubles with infections.
Okay. And besides antibiotics, what else would you suggest to your patient?
Due to an infection.
Mhm.
Well, besides antibiotics, maybe there is pain. I would suggest a painkiller. I don't know,
Mhm.
maybe ibuprofen is a good one. Um, paracetamol too. Yeah, I think that would be enough.
Okay. Any care extra, maybe?
Yeah, cleaning of the genital area.
Mhm.
Um, Also drinking a lot of water because it works. It works really good. And yeah, I think that would be enough. Of course, depending on the kind of infection, if it's a urinary infection. I have a funny story. Like 2 weeks ago, I have a close friend from high school. He just texted me up and told me, "Hey, how's it going? Can I ask you something about hospitals?" And I said, "Okay, yeah, no problem." I thought he was going to do something related with research because he works on economy and that stuff. And he told me, "Yeah, I have this insurance, and they have like programming my lab test for from here to 1 month, and I want to know where can I do them like faster. I don't care if I have to pay." And I told him, "Okay, but I need to know which lab test you need." And he told me it might be something urinary or and sexual transmission infection. And I was, okay, tell me what are your symptoms, what is going on. And he told me, yeah, I have a sexual intercourse without protection, but now I have painful when I have pain, like burning pain when passing urine, I have pain when ejaculating, and I have little lesions that are really itching. And I was okay. You gotta go somewhere to get it checked. And I told him CS, like it's a
Yeah.
good place, you know, it's a good place
Yes,
to that stuff.
I heard
And like
about it.
2 days after that, a female friend,
No.
yeah, yeah, it was really funny. She texted me up and told me, I have a friend that has this trouble. She had sexual intercourse without no protection, and she sent me the photos of the lesions. And she told me, and my friend doesn't want to go to the doctor because she's really shy. And I told her, but she needs to get this checked because I think it was trichomoniasis,
Oh my God.
because she had another sexual intercourse that wasn't my friend, and she got something wrong there. And I told her she has to have this checked, because I thought on trichomoniasis, I thought on a VPH, because it's really important to relate them both. And my friend told me, no, my friend doesn't want to go to the doctor. She's really shy. And I told her, okay, so
You
tell
must.
her, tell her that she needs to start the treatment right now, because it might get worse. There are some fertility troubles and that stuff. And I gave her treatment for trichomoniasis, and I think only trichomoniasis, because that was the only thing I was thinking, because she had what was it called, whitish discharge.
Mhm.
And trichomoniasis is the only one that gives like a whitish discharge. So I told her to go to the gynecologist, but she didn't want to go, so I had to do something and just gave her treatment for that.
And then, and now they write it to you again? Well,
I don't
I'm
know.
good.
Yeah, my friend, my high school friend, told me that he's doing well. He started treatment. He went the day I told him, he went to the that healthcare service, and he
Okay.
started treatment. He's feeling well, but I don't know about the girl, because she's not my friend. She's a friend's friend, so I don't know about her.
Mhm.
And my friend told me that she wasn't planning to go to the doctor, so that might get worse.
Oh,
Yeah,
I
it is a
know.
funny story. I just remember
Yeah.
it because something that happens, no, and I couldn't tell my friend. I know the girl you.
She has
Yeah,
to.
yeah. Of course, I cannot. This the secret, the medical secret that we
Yeah.
handle it. So yeah, it was really funny.
Yeah, I know. Well, but it's impression. Girls here in Bolivia are so shy, and they really don't want to go. I know friends that has 35 or 36 years old,
Imagine that. Yeah,
and they won't go to the doctor.
yeah. That's a big trouble.
Yes,
We have to, I don't know, put that taboo out, because it's really
yes,
important to
it's
get
really
checked
important.
when it happens. And it doesn't matter if it doesn't happen, but you also have to get your pap everywhere,
Yeah,
all your tests with a gynecologist. It doesn't matter if you don't have like many, I don't know, intercourse sexual couples with no protection. It doesn't matter, because you don't know what can happen. I don't know, in a public restroom. It can also, you can
yes,
also have some fungus infections, or in some trichomoniasis too. It happens. I don't know, or pools, public pools. You never know if it's clean or
yes.
not.
How
Yes, everything.
dangerous.
Yeah, everything is dangerous relating that. So
How dangerous for a woman.
yeah, yeah.
Okay, Jorge, thank you so much for
Oh
the
no,
for
no
this
problem.
story. It was so
Yeah,
good
it was really funny.
and interesting. Yeah,
Yeah, because you never
funny
know.
too. Yes, we have to work a lot of um, talking with our friends, not only with people around our careers, but with our friends. But because they are people that have studies and have money, so but they just
Yeah,
don't want
they
to
just
want to go.
are afraid of what can happen. But I'm glad that some girls, some friends that I have, they are like they trusted me. So I always talk really with the professional, in a professional way, of course. because they know I'm a physician. So yeah, of course,
And you're
I want to help her. Yeah.
yes, and you're laughing on on
Yeah,
their side.
actually, it's a funny story, but I did everything right. I think I
Yes.
never, not even the girl, not even my friend. I didn't tell him what really happened. So it's just secret that I can count on. I think I can tell anybody without names, of
Yeah.
course.
Oh, of course. Yes, but it always helps a story like this.
Yeah, this topic, your nervous system, and I thought
Such an
about that
example.
story and just a great example, so I can talk about symptoms and that stuff. And yeah.
Yes, that's right. I agree with you. Okay, I will send you my questionnaire,
Okay, perfect.
or I don't know if you can see it.
No, not yet. Okay, right now.
Okay.
I got it.
Yes, I have a friend, a doctor,
Oh, really?
and when I feel sick, he is the first person I can call and tell him, well, do you think it's really necessary to go to the hospital or
Yeah,
something?
it happens every day. I think it happens
Yeah.
every day.
Yeah,
You know,
it
you,
helps.
you trust on him or
Yes,
her,
of
and
course.
that's something nice.
Yes. I work traveling a lot, and I go to some rural areas when
Okay.
they don't even have water. So it's so difficult for a woman to go
Yeah,
up
I
there.
bet so. It happens. Yeah, when I was doing my rural service, I didn't have water either, so it was awful. Thank God my colleague had like a portable shower, and we
Yeah.
could work with that. It was great. I didn't know that exists, but it was great. It was really helpful for us. It was like I don't know, like rubber bag, and put hot water on it,
Mhm.
and it works with gravity, so it was great.
Yes, they find a way to make it work.
Yeah, thank God it was really helpful.
Yes. Okay, thank you so much,
Oh, thank
Jorge.
you.
And have a great weekend. See you on Monday,
You
okay?
too. Thank you so much.
Okay. Take care.
See you on
Bye-bye.
Monday. Goodbye.
Hello, teacher. Good evening.
Hi, Irina. Good evening. I'm so sorry. I was running out. Okay. I'm so sorry, Irina. Hi.
Hi, no
I was
problem.
running from here to, I don't know. Okay. Okay, Irina, I would put you in a situation. Imagine you have a patient, a female patient that comes to your consultation and you're suspecting she has some urinary system troubles. Okay. Which type of questions would you make to make sure that you're giving the right diagnosis?
Okay, that patient, I'm sorry, it's a female or
Female.
male? Female. Okay.
Yes.
Okay. I suppose that the patient told me that has a doesn't feel well, I think. So if I suspect a problem of the urine system, I have to ask about the first question is, have you ever how many times you don't have well, and then according with the period of time, This next question is about, do you have fever? Or do you have a high temperature in this day, in one moment of the day, in the morning or the afternoon, in one situation? Another one, it's about dysuria, but that the way that the person can understand me, I have to ask here about do you have pain when you make water or work you will make water? And the next one is about the nicturia. Nicturia.
Nocturia.
Nocturia, I'm sorry.
Nocturia.
Nocturia. The another one is how many time do you go, how many time you have to go to the bathroom? And when you make waters, how many times or how much water in your urine you calculate or you feel? I mean, you make waters a lot, a little, or you don't feel finished when you go to the bathroom. Another one is about the pain. Do you have any pain about the area of the low back? And exactly what pain do you feel? Or do you feel pain when you go to the bathroom? Especially, yes, I have to ask the same question. About especially the area, the low area of the abdomen, if the person have pain. The another one is about the appearance of the urine.
Appearance of the urine.
Urine.
Appearance.
Okay. For example, when you go to the bathroom, you can see what the color of the urine is. If you can see a color red, or the smell, what the kind of smell, or if you can see a disturbance consistence or disturbance appearance.
Appearance.
Another appearance. And I don't know, espuma in the urine.
Okay, I will look forward. Continue, please.
Okay, that is about I feel the fever, the location, the dysuria, nocturia. I think that, and I think the last one is about do you when you start you have the pain or don't feel well. Do you take any pills about the pain or something before to come here? Because it's that usually, yes. And the another one is about the history of that patient, because it's the patient is a female. It's important to ask about the cytology. How many, when if she takes a cytology, I think that is the
cytology.
Cytology
test.
A cytology test. When, and if the patient asks yes, say yes, sorry, and when she takes the cytology test. And about the history, it's a gynecology history. is about if the patient has in the last 2 weeks, maybe 2-3 weeks, or when the symptoms appears, if she suffer any infection, like infection that is
What type?
infection. Sorry.
What type of
It's about the candidiasis or infection.
genital area?
Infection of the genital area.
Genital infection or infection of the genital area.
Okay, if she has a genital infection, that is the question. Foam in the urine.
Yes, foam in the urine is espuma.
Okay.
Okay, so your anamnesis was really, really complete, Rina. So I think you already has the diagnosis. Okay,
that is very common here. Yes.
Okay, but imagine that you're suspecting, you want to confirm this situation, and you have to send to your patient to do some lab tests. What type of tests would you suggest to her?
Well, the mainly is the urine test general. I think that is in English.
Urinalysis?
Urine. I don't know if that's the same because in Spanish there is a difference. Examen general de orina, and another one is urocultivo. And another,
this is another.
And another one is when we talk about the class about use the stick. That is the
urinalysis.
Urinalysis. But well, urinalysis is the same is with the stick.
Yes.
And okay, if that person, if I have that test, I probably use that urinalysis. The another one is sent to the patient to take an exam, precisely a urine test from the laboratory. No urocultivo. I mean another similar general. Yeah, general test. But that kind of test, I have to say the patient that it's preferred to take in the morning with the first urine. There isn't a name, but I don't remember. It's a test about the medio chorro in Spanish. Well, I say the patient the first urine in the morning is very important because that urine concentrates the most of bacteria. If the person have an infection, that's a type of the kind. So urinalysis, the general test, and the last one, if the patient or I recognize that patient use a lot antibiotics, I have to antibiotics. I have to send her urocultivo for determine the resistance of the bacteria about the antibiotics. Yes, I think that is the first test that I have to take her.
Okay. First stream of urine. First stream, I will write it down, of urine. Oh, I'm sorry. Test. First stream urine test.
Okay. The first stream. Okay.
Okay. Okay, that was good. And well, you're already now confirmed what you were thinking about this case, and now you have to give her the treatment. What would you suggest?
There are two antibiotics that is usually to use here. The first one is the trimethoprim sulfamethoxazole. I don't know if that is the name of in English. See, trimethoprim sulfamethoxazole, that is the name of in English.
Yeah, I think it is.
Okay.
It won't change.
Okay. Okay, that is the first. The presentation is the pill. The medication is 5,000 milligrams, and the doses of the treatment recommended is 2. It's a one pill in one pill one pill each 12 hours. For 10 years, for 10 days.
Okay.
Sorry.
I was
oh
like,
my God.
How long is the treatment? I won't even
Yes.
have kidney to resist.
Poor liver, poor liver.
Yeah.
10 days. That is the first one. The another one is use amoxicillin. There is amoxicillin. It's a pill each 8 hours in the same period of time for 10 days.
Okay.
Days. And drink a lot of water. That is the first one.
Okay, that's a good suggestion. Okay, perfect. And well, you have a very complete treatment and description of the treatment and in the questions. Rina, that's really good. Every time I talk to you, it's really interesting because you tell me a lot of things that really help, and it's very complete. The only things that we are having a little trouble is with the pronunciation, but it's going less with the time. Okay, so you're improving. It's so good.
Thank you, teacher.
I like your conversation. Thank you.
Thank you.
And I will take a picture. Okay, one more. And I'll let you go and rest for the weekend. And see you on Monday, okay?
Okay, teacher.
No, I don't know what I did. Sorry. I'm new with technology. Okay, take care, Rina. See you on Monday. Bye-bye.
See you, bye.
Bye-bye, take care. Hi, Ale, good evening.
Hi, teacher. Good evening.
Good evening. Ale, I will put you in a situation, okay?
Okay.
Imagine you have a patient, a female patient, that you're thinking she has some issues with their urinary system. So you have to be sure, of course, and you will ask some questions. What type of questions would you ask?
Okay, maybe first the habit of or the technical for clean, because the most common reason for have infection to the urinary system is that technical of cleaning before the defecation. And it's most common in women because we have a ureter, a short ureter, if we compare with the men's ureter. Then maybe the color of the urine.
because sometimes it's more dense and has a bad smell. Then it's important to know how many or how often she has urinary infections or urinary problems. Then if she had pain, she had a mixture. Or she had pain the plate location.
Okay.
Or maybe urgency emergency
Incontinence?
Incontinence. Sorry.
No worries. I know it was on the on your tongue.
Yeah, that's the most common signs for urinary disease. Maybe sometimes we have systemic signs like fever for pyelonephritis, but that's not really common. The urinary tract infection is the most common of the urinary disease.
Okay, just one thing, pyelonephritis.
Pyelonephritis. Okay, teacher.
Remember always everything that ends with itis, it's pronounced itis, okay?
Okay.
Okay, just that. And that was good. Now you have some answers to your questions. What maybe you want to confirm your diagnosis, sending her to do some lab tests. What type of lab tests would you suggest?
We have two options. The most common is the urine analysis. And we have two big aspects for this. The microscopic we can see the color sometimes in patients that have a specific urinary, not urinary, or maybe hepatic or kidney disease like hepatitis. You can see brown urine. Or for nephritic syndrome, you can see hematuria. You can see a red or pink urine.
Okay.
Then is the urine turn dense when you have a urinary or a specific urinary disease. Then the microscopic aspect, you can see leukocytes, a lot of leukocytes in the urine. You can see sometimes erythrocyte. One thing that we say, I don't know what is the correct term for a campo cubierto of bacteria.
Okay, it might be a covered camp, like in past, covered camp of bacteria. Almost the same.
Covered camp of bacteria.
Like that. Covered camp of bacteria.
Okay. That's one sign for maybe urinary infections, but it's not specific because we have a normal bacteria in our urinary system. specific in the urethra. When we want to know if the patient have a infection or not, is the cultive
Yes.
of the bacteria or the microorganism. And we have antibiogram for see the sensibility of the bacteria, because in these days it's common that the bacteria have resistance for some medicines.
Antibiogram. Yes, that's good.
Yeah, with that we can confirm the infection or discard.
Okay, perfect. And in this case, you confirm your suspects. Okay, so what type of treatment would you suggest to your patient?
Okay, first is the antibiotics, like ciprofloxacin or levofloxacin. It depends. Maybe first the ciprofloxacin is the first line. If the patient don't have a good response to that medicine, we change the antibiotic.
Okay.
Then we can give to the patient some medicine for the symptoms like dysuria, and some analgesics like, I don't know, ibuprofen or paracetamol.
Okay.
And recommendations for had a correct technical for clean. Then maybe I don't know how you can say vaporizaciones
Okay.
con manzanilla.
Mm-hmm. Yes. Here in Bolivia, especially, it's a good thing.
Yes.
And it helps. Okay, I will look for this word, this phrase. Continue, please.
Take a lot of water. And in new articles, we can see the arándanos or blueberries.
Blueberries, yes.
Blueberries have a good function of the urinary system, because they have they act like antiseptic and prevent the infections of the urinary tract.
Okay, that was good. It's vaporization.
Okay.
Manzanilla plant.
Okay. Yeah, the vaporization is a good option for calm maybe the pain in that zone.
Yes, I didn't know about the blueberries till this day, so that's a good choice too, because it's natural, and it will help. Of course, it's not the cure, but it will help, right?
Yes.
Okay, that's good. That's good, Ade. And the last thing would be to choose any type of condition you want and make an examination, a complete examination.
Okay. I don't know, maybe the pyelonephritis.
Yes, of course.
Okay. We can see a patient with fever. Then to the physical I don't know if I forget some words. Examination, physical examination. Um,
It happens.
Pain of the kidney location, and we have not maneuver, but a medical sign. We golpear.
Okay, to hit, push,
Yeah.
punch.
To punch that part. If the patients refer a pain, that's a positive sign. Is positive for pyelonephritis. Then the characteristic of the urine. In this case, the kidney have a affection. The color can change, like brown urine. In some cases, have espuma.
Foam.
Foam.
Yes, foam, like.
Yes.
Mhm.
Like a foam. Or maybe turn pink for some erythrocyte cells. And the microscopic aspect, we can see nitritis.
Yes.
And that's a substance of bacteria.
Okay. And I'm sorry to send you right now in the middle of the explanation, but we're almost on time. Please fill my questionnaire. Thank you so much, Ali. That was good. That was really complete. I found out that you improve a lot, Ali. It's just that you're thinking in another things in this moment. You're not focused sometimes, and I can understand that because it happens the same to me.
Yes.
Okay. Sometimes I like thinking about 10 things at the same time.
Yes, and you forget some things.
Yeah, that's not good. But with the practice, I think it will be better. Okay, and it will come natural because you're learning, you're remembering every time more words and more expressions in English, more technical descriptions and everything. So it will be better. Okay.
Okay, teacher. Thank you.
Okay. Take care. Have a great weekend and see you on Monday at 8.
See you on Monday, teacher. Have a good weekend too.
You too. Bye-bye.
Bye.
Hi, Weimar. Good night.
Good night, teacher.
Can you turn on your camera, please? Thank you. Okay, Weimar. Imagine you have a patient that has some symptoms that makes you think she has urinary problems. What type of questions would you ask to her?
¿Qué preguntas haría sobre los síntomas de sistema urinario? Okay. What color is your urine? Do you get any burning or pain when you pass water? Are you urinating very often? And what quantity? Cantidad?
Quantity.
Quantity? Do you have any trouble getting started?
Getting. What is the question? Can you repeat it, please?
Do you have any trouble getting started?
What do you want to say with that question? In Spanish.
¿Tienes algún problema para empezar?
O sea, estás diciéndole si para comenzar las preguntas, ¿tiene algún problema?
¿Tiene algún problema para empezar a orinar? ¿O tiene algún, o sea, más o menos?
Al inicio, ok.
Yes.
Pero ahí falta, ¿no? Do you have any trouble starting to urinate? Eso falta.
Okay, teacher.
Okay, go ahead.
Is the stream of urine normal?
Okay.
Is the stream strong? Or drops?
Drops.
Drops.
Drops, como
Drops.
gotas, ¿verdad?
Yes, teacher.
Okay. What else?
Do you have nausea? ¿Tiene náuseas?
Nauseous. Nauseous.
Have you vomited?
Have you vomited? Remember that when you talk about, cuando hablas de la B dentilabial es B, vomiting. Cuando hablas de la B labial es ba, B. Pero B chica, vo, ¿ok?
Vomited. Okay,
yeah, vomiting or vomited. In this case, have you been, have you vomited? That's the question, right?
Yes, teacher.
Okay. Continue, please.
Más o menos, teacher.
That's all?
You have fever?
Do you have fever?
Sí. Yes.
Okay. Okay. Those are the questions?
Yes, teacher.
Okay, that's good. Well, you have to be sure that you're making a good diagnosis. So which type of tests would you suggest to your patient?
Urinalysis or urine culture, no, cultivo de orina, culture.
Yes. Buscamos el significado o la traducción correcta. No creo que sea culture. Debe ser cultive, urine cultive.
Cultive.
Pero no estoy segura. Vamos a averiguar y recién les voy a decir el lunes, ¿ok?
Okay, teacher.
Ok. What else? ¿Qué más?
Continue, teacher.
¿Qué más? ¿Qué otro test? Which other tests?
Pues,
¿Esos son los más importantes?
Ecography.
Okay. An ecography?
Yes, teacher.
Okay. Why is that? Why?
¿Por qué, teacher?
Explain to me. Explícame por qué una ecografía.
Because in continents urinary descenso, teacher, ¿cómo se dice? Descenso.
Check. Okay, continue.
Bladder, quería decir descenso de vejiga, bladder, descenso, ¿cómo se dice?
Okay. Quieres revisar, pero ¿qué quieres decir en realidad? No podemos traducir palabra por palabra, es mejor que traduzcamos toda la oración.
Bueno.
¿Qué es lo que quieres decir?
To be able to see bladder descent, para poder ver descenso de vejiga.
Bladder descent.
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 Con D-E.
Descent.
Yes.
Descent.
Pero cuando tenemos una palabra que tiene S y luego C, es descent. Ok, acentuamos un poquito más la S y luego la C. Descent. Tal cual. Yes. Okay. What else?
¿Qué más, teacher? Teacher?
Okay.
No.
What else? Mute.
¿Qué más?
Any other test or that's all?
Eso es todo, teacher.
Okay. So with those tests, you are confirming your diagnosis. And this patient has trouble with her urinary system. So which treatment would you suggest to your patient?
Otros, bueno. hypertrophy prostatic.
No. I'm telling you which treatment would you suggest to your patient. ¿Qué tratamiento le vas a dar?
Tratamiento. The treatment in infection urinary
Urinary infection.
is ceftriaxone, carbapenems, imipenem, or nitrofurantoin.
Okay. Okay, and what other recommendations?
Bueno. Y bueno,
¿Qué otras recomendaciones?
not use public toilets, baños
Okay.
públicos, tener cuidado con los baños públicos.
Okay. Weimar, we don't have enough time. No tenemos mucho tiempo, pero te pido que por favor llenes mi cuestionario, mi encuesta. ¿Puedes verla?
Yes, teacher.
Ok. Estuvo bien. Estuvo bien. Estamos mejorando la pronunciación, como te había dicho la otra vez, pero aún necesitamos práctica, ¿ok? No me sale. Ah, ya me sale. Okay. One more picture. Okay. Thank you so much, Weimar, and see you on Monday at 8 o'clock. Okay?
Okay, teacher. Thank you. Bye.
Bye-bye. Take care. Hi, good evening, Jocelyn.
Hi, teacher. Good evening.
Oh, okay. Okay, Jocelyn, I will put you in a situation. Imagine you have a patient that has some troubles with her urinary system. You have to ask some questions to make a diagnosis. And what type of questions would you ask to her?
hacer preguntas para llegar al diagnóstico del examen urinario?
Sí. Tu paciente tiene, o sea, tú sospechas que tiene un problema en el sistema urinario. ¿Qué preguntas vas a hacer para llegar a un diagnóstico?
Ah, ok, teacher. You have any difficult for urinating? Do you get any burning or pain when you pass water? Sería, do you ever lose control of your bladder?
Okay.
Any leaking or dribbling, goteo, dribbling.
Yes.
Después sería, have you ever taste blood in the urine? Do you have a fever? Do you have a vomiting?
Okay. What else?
Do you have dizziness?
Dizziness.
Dizziness. Para poder identificar una cistitis o una pielonefritis.
Okay. What else?
What, teacher?
¿Qué más? What else?
Ya. Diagnosis, general urinary test.
¿Qué le quieres preguntar?
No, podemos diagnosticar, quería decirle, teacher. Quería diagnosticar por examen general de orina.
Ah, ya, pero estamos preguntando, estamos haciendo anamnesis todavía, preguntando a tu paciente.
Ya había terminado el sector de preguntas, entonces para poder identificar si es una cistitis o una pielonefritis, entonces le podemos realizar un examen general de orina.
Ya, ahora dímelo, trata de decírmelo en inglés.
Ya. Diagnosis in diagnosis. No, ya sé, ya me acuerdo, sí. Can we do a urinary test? Me olvidé cómo se dice. También, teacher, ¿cómo se dice?
Two.
¿Do?
Two.
Do.
T-O-O. Two.
Ya. Do urinary cultivo.
No, es que, sabes, cuando haces la traducción no puedes traducir palabra por palabra. Es diferente. En español no tiene el mismo orden que en inglés. Nunca vas a poder hacerte entender si quieres traducir así. Porque tú quieres decir, venga con un examen de este tipo. También con este otro examen, ¿verdad? Pero en inglés es, venga con este examen y con este otro examen también. ¿Me entiendes? El orden es diferente. ¿Ok? Entonces, por eso yo te digo, para que puedas tú hacerte entender, tienes que formar frases. no traducir palabra por palabra porque se te va a dificultar mucho. No vas a poder hacerte entender ni vas a poder expresarte mejor, ¿ya? Puedes decirlo como has dicho, pero comenzando por los 2 tests y después dices to, también, porque ese to, ese también siempre va al último. Nunca en medio, nunca al principio, siempre al último. ¿Ok?
Ay, eh, can you can you re, can, ay, me has dicho que no, ¿no? Podemos hacer igual que el inglés que otra.
Puedes cambiar tu pregunta por una orden. Por ejemplo, you have to, usted tiene que, you have to make a test. Usted tiene que hacerse un examen.
Y también se podría decir, can you perform the test urinate or urinating test?
Urinate test.
Yeah.
Urinary test. Can you perform a urinary test? Is the correct question. ¿Puede hacerse un examen de orina? Es así. Eso es correcto.
Okay.
Pero la pronunciación, Jocelyn, por favor. Can you make or can you perform a urinary test? Con seguridad. No dubites.
Okay. Eso sería.
Okay. Yeah, Jocelyn. Now, the treatment. What type of treatment would you suggest to your patient?
The treatment is ciprofloxacina, ácido nalidíxico, nitrofurantoína, amoxicilina más ácido clavulámico, cetriaxone creo que se pronuncia en inglés.
Yes. Ceftriaxone.
Cetriaxone. Gentamicin. Vancomycin.
Okay.
Ese sería.
Ok, Jocelyn. Está bien, Jocelyn. Yo sé que tienes muchas ganas de esforzarte y hacerlo mejor. Está bien. Están bien las formas que estás tratando de utilizar para expresarte. Lo único que tienes que tratar de escuchar más, tal vez películas en inglés, canciones en inglés, tratar de comprender, ¿ok? Les he pasado un TikTok, te ha pasado Gamer, ¿verdad?
Sí,
ya. Cuando te sale ese TikTok, creo que el algoritmo te vuelve a mandar otros TikToks de personas que están hablando inglés y que están enseñando también, ¿verdad? Debes tener harto ahora. Entonces tú vas viendo la pronunciación, y con seguridad tú tienes que hablarme a mí, sin vergüenza, sin miedo, porque yo al principio era así también, a mí me daba vergüenza hablar más con una persona que habla español que con una persona que habla inglés, ¿no es cierto? Pero no tienes que tener vergüenza porque estás aprendiendo otro idioma y lo correcto es hablarlo de manera correcta, ¿verdad? Cuando viene un extranjero y habla con nosotros, se equivoca a ratos y no le entiendes muy bien, es como que, pero ellos intentan y al final terminan hablando. Nosotros tenemos que hacer lo mismo, ¿ok?
Ok, teacher.
Muy bien, muchas gracias por llenar mi cuestionario. Jocelyn, voy a tomar la fotito, espérame. Una más. Y nos vemos el lunes. Yo los voy a castigar estas semanas, estos fines de semana. Creo que no van a tener tiempo más que para escuchar cosas en inglés, hablar en inglés, pensar en inglés, para que mejoren. ¿Ok?
Ok.
Ok. Muy bien. Muchas gracias, Jocelyn. Nos vemos el día lunes. See you on Monday at 8 o'clock. ¿Ok?
Ok, teacher. Goodbye.
Goodbye. Take care. Hi, Carlita. Good night or good evening.
Hi, how are you?
I'm fine, thank you. How are you?
Fine. A little bit tired, but fine.
Yeah, me too. As always. Okay. Okay, Carlita. Imagine you have a patient, a female patient. You're suspecting that she has some urinary troubles. Okay. And you have to confirm your diagnosis. What type of questions would you make to her?
Okay, first of all, the age of the patient, because if it's female, she could be a child or a teenager, a woman, or how do you say adulto mayor?
An older woman.
An older woman, and so the first thing, the age, if she is in I don't know how to say this, fertility age.
Yeah.
Yeah, I may ask if she has a sexual life.
Yeah.
I could ask if she how many times she goes to the bathroom, if when she goes to the bathroom, if it burns when she pee.
Huh?
Sorry, I had
it's
my
crazy.
Yeah. How many times she goes to the bathroom, and when if it's burned, it burns when she pee. It's okay.
Yeah, or you can say in some technical words, if it's burning when she's urinating, or when she's going to the bath.
Urinating. Okay. If she has chills and fever, and I think that's the most common questions of
Okay.
science.
Okay, that's good. And to confirm what you were asking, maybe you should send her to do some tests. What type of test would you suggest to her?
The first thing, I think, urine test, and if she has fever, I think I just forgot how to say biometry.
Biometry?
Biometry. A biometry to look for some elevated white blood cells, and if the urine test is positive, I think I could make I don't know how to say this in English, urocultivo.
We have these things surrounding our heads with other of your classmates. When we look for the translation of this, it comes out urine culture test, but I don't think
I don't think so.
it's good. Yeah, so we will look for that includes you, okay, to
Okay,
find out
I'm gonna ask.
what is the correct definition of this. Well, for me, it's urine cultive or something like that.
Okay, I'm gonna look for this.
Okay.
Okay, just give me 1 second.
Yes,
Something is
yes, of
happening with
course.
I don't know what's happening with my dogs. Sorry. Okay, I think that's the first thing I just do. And if this urine, we don't know how to say this, cultive is positive, we have to look for the antibiotics is sensitive to.
Okay. Okay, perfect. And you confirmed that your patient has that or urinary troubles. So what type of treatment would you suggest?
The first thing, antibiotics, analgesics to the pain and fever.
Painkillers.
Painkillers, sorry. Painkillers, yes, it was in the test. Painkillers, antibiotics, vitamin C.
Yeah.
This hygiene culture, I will explain to the patient that she has to go to the bathroom every time she wants, even if it's more than usual, because that's an interesting way to eliminate the bacteria. And there's some drug called well, I don't remember the name. I have the commercial name.
Nitrofurantoin?
No, that's kind of a antibiotic, but
Okay.
it's here in Ecuador we call the commercial name, the more common is Bladuril. I don't know if in Bolivia you have that, but
I don't know, maybe, but I really don't know. I'm sorry.
But what this make is that your urethra get dilated.
Delayed. Yes, dilatate. It might be.
Okay. Yeah, dilatate. So when you go to the bathroom, you don't feel that pain that we in Spanish said dysuria.
Okay.
So I think that for the first 5 days, and if the signs and symptoms goes or go away, I don't know. I think in a month I would make some another urine cultive. We don't know that word. to confirm that the bacteria is not anymore in your organism.
Okay. Delayed.
Delayed. Yeah, that bloodletting makes your
Delayed. Yeah.
urethra delayed. So you don't feel pain when you go to the bathroom and you go and you pee. You don't feel that pain.
Okay, that's good to know. It happens, I think, to every single woman sometime
Yes.
because of a lot of factors, right? It's important
Yeah,
to know
even
that
in
first.
child.
Yes, especially. Okay. Okay, Carlita, that was good. And now that we have time, I want you to pick up or choose one disease, any condition you want, and make examination, a complete examination.
To the urinary system.
If you want, it's up to you.
I think with the urinary system that we're talking now, when you do the examination to the patient, you ask to the patient that acostarse,
lay down,
to lay down, and you palpate. Oh yes, palpate the abdomen, your body.
the abdomen.
And we have some urethral points.
Okay.
So you have down, mid, and up urethral points, and you have to pressure in your abdomen. And if the patient feel pain, you could realize if you have an infection in the upper urinary way that contains the kidney, or in the down urinary ways. So another thing that I would do is to ask the patient to sit, and we puño. I don't know how to say this.
Please. Yes, I think it's that. I forget. Two.
There's
okay.
a way to know if the urinary infection is in your kidney. So in Spanish we said puño percusión.
Yes. A bliss percussion, I think. We were talking about, someone mentioned that.
Yeah, bliss percussion.
Where is it? Oh, okay, I lost it.
Yeah, so I think that could give me the idea that the patient had the infection in the kidney. So in that way, I change, or I ask some other exam like ecography to watch if the kidney is okay. And I think that's the inspection for a urinary disease.
Okay. Yes.
You don't have to.
Bliss
You don't have
percussion.
to. Bliss percussion.
No, fist.
A fist.
Yes. I told
I
you.
don't know what's happening with my dogs. They are just crazy today.
Fist percussion.
Fist percussion. So in the urinary system, you don't have to palpate or auscultate. You just have to. Sorry, you have to palpate, but you don't have to ask to make the auscultation. And
the test.
I think I think it's more simple what you're looking at. Sometimes when the disease is in the down way, you are gonna notice that the clinical exam is okay, but the symptoms of the patients, that dysuria and nicturia, fever, chills, etc., is presented in the patient. So the symptoms of the patients are mandatory to decide what to do.
Okay. Okay, that's really good. Thank you, Carlita. That was good. Just one thing. Symptoms.
What I just said.
Symptoms.
Chavo del
But-
Ocho.
No, but that's good. Sometimes it happens to me. It happens to everyone. So it's just practice.
Yeah, I need to practice more. I think when I want to talk, I just got blocked. I don't know.
Yes, but these 15 minutes are really important to practice. I think making mistakes is the best way to practice. So don't worry.
Okay.
Yes, you're improving. You have the knowledge of a lot of words, technical words in English. So you try to make you understand in a better way. It's just little things that we should work on. Okay.
Okay, I'm gonna read a little bit more.
Better pronunciation in some specific words is not everything. Some specific words, because you don't know the meaning. Sometimes it's a new word, right? So no worries. Yeah, you will improve. You have the knowledge. Okay.
Okay, thank you. That's a good notice.
Thank you, Carlita. See you on Monday.
See you on Monday. Okay.
8 o'clock Bolivian hour. Okay.
Okay. Have a good weekend.
Thank you. You too. Bye bye.
Thank you.
Good evening, teacher.
Good evening, Vale. Just give me a second, please.
Don't worry. Take all the seconds you need.
Okay, thank you.
You're welcome, teacher.
How have you been feeling?
I feel better, but I'm only with runny nose. But all the time, I think I already use all the paper, like one big roll, and my nose is really red, and I can touch it because it hurts. But I'm okay.
Okay. That's really good to know. So I think you don't have COVID. You just have, I don't know, some fresh air on your back or your throat.
I'm think the same because one day before yesterday, I have like a girl night, and I had to sleep with my two friends, and I was in the middle. So I was really hot, and get all the
Blanket.
Exactly. So I think that night I get this cough, maybe.
Okay, but you're getting better. That's the good news.
Also tomorrow I will do a COVID test. Only
Yeah,
for
it will
sure.
be better.
Yeah.
Yes.
For peace of everybody in my house.
Yes. You have to use your mask.
Yeah.
Just in case. Okay.
But I think I'm good.
Yes, that's true. Okay, Vale. Imagine you have a patient that, well, you're suspecting she has some urinary troubles, okay? What type of questions would you make to her to look forward what she has really?
Uh, mm, well, I first will ask if the patient has something different in the frequency that she goes to pass water, I think it's okay, or go to the PP. First, and something normal of the frequency. Maybe she noticed that she's going more frequently, so maybe it's important. Another thing I can ask if she has some difficult in the start of the past water, maybe if it's something different in the aspect of the urine, maybe the color or the smell, or maybe she noticed like um, something white, I think, like how do you say espuma?
Foam.
Foam. Yeah, maybe she noticed foam in the urine. So the aspects of the urine, maybe if the frequency is more regularly, if she has some trouble in the beginning, or when she's going to pass water, she feels some pain. Pain, frequency, pain. Yeah, maybe I will ask about that.
Okay, that's good.
Or maybe if she has some pain, not only in the when she go to the bathroom, also maybe in her back, in the low part of the back. Yeah.
Okay.
Those
okay,
questions.
perfect. And in order to make sure that you have a good diagnosis, you should send her to make some tests. What type of tests would you suggest her to make?
I think the most important are I think it's like a basic test. It's like the basic test is the general exam of urine, like classic one, when they it's like 3 parts: macroscopic, microscopic, and like they see the aspect of the urine, like the color, the smell, density. Maybe it has some cells that are abnormal, like red cells, or I read this in the slides. Cilindros. I don't remember the name.
Cylinders. I think I remember someone mentioned that too, but I don't remember very well. Okay.
But I will do like that. First those and the general. Then depends of the results. Maybe you can do like a urocultivo.
Yes, we have the trouble with that word or with that phrase, because when we look for this on Google, the translation says your culture test, and I don't think it's the correct translation.
Maybe
So,
you can say bacteriologic test.
yeah, it would be better, but we will look forward, including you. Okay, you will look for an answer, and maybe we can talk about this on Monday.
Okay, I will search and also do the test to see which antibiotics are better for the bacteria.
Okay, perfect. Cylinders. I write down on the chat.
On the top, cylinders. So
Mhm.
depends of the basic one, like the general, you can do this only for bacteriologic test.
Bacteriological tests.
Okay, bacteriological test.
Mhm.
And maybe, but I'm not sure. Also, it depends the symptoms that the person has and the results. You can do like echography or of the kidneys
Mhm.
to see if the infection is in the talking about the urine system, is the infection is only in the low part or it's in the upper in yeah.
Yes. Okay, that's good. And what type of treatment would you suggest once you confirm that she has this kind of troubles?
Well, it's really important. You know, like the infection of the urine system is more frequently in the woman. So you have to teach like the basic things of the, for example, it's important the way that you clean your genital part when you go to the bathroom, because it has to be front to the back. Front. So you have to teach and be really careful with this. And then the person has to drink more water, and then it has to do the treatment, pharmacological treatment for 7 days, and it has to be like really serious.
Okay. Okay, perfect. We have the treatment, we have the recommendations. That's good. That's good, Valley. And the last thing, we have few minutes. I want you to choose any type of disease you want and make a complete examination.
Okay, you can talk about cystitis, like we are talking about this.
Yes, you can. Cystitis.
Cystitis. Well, first, you have to ask about the symptoms that the patient has, and say the important thing to the cystitis is that it's really painful when you pass water in the end, but you go to the bathroom, you're passing water, but the pain is in the end. And then it's important because it has red cells when you go to the bathroom, when you go to pee. So those questions are really important. Then for like for palpation, because you can like do auscultation in urine system, but it's important that you can touch in the abdomen, the parts like, I don't know how to say in English, but ureteral points, maybe.
Yes, ureteral points.
That are positive, more frequently in the second ones that are in the middle. And also in the back, we have the method of like puño percusión.
Yes. I write down on the fist percussion.
Okay, fist percussion, that also are positives, or is positive. It can be positive in the both sides or only in sides. Fist.
Okay.
And yeah, I think those are important. And also for like really be sure for the diagnosis, it's the test.
Okay. Okay. That was very good, Vale. You have improving a lot because I know you are so energetic when you talk, when you express your ideas, and that's so good because it makes so interesting the conversation. Okay.
Thank
Besides, it doesn't send you to another place. As I told you, it's really interesting. So I constantly have my attention on you, on what you're gonna say, and that's really good. Okay, just
I
pronunciate.
know that my like I understand English when you are talking about. I really understand, but
One
I
more.
think I'm not so good when I'm explaining. I don't know. My brain is not working so good, but
Oh,
I
yes.
person understand what I'm trying to say.
Yeah, of course your brain is working, but the thing is that you're not focused when you have to, or you're not concentrated when you have to explain yourself. I know you have a lot of things to say, but you're not putting in order your ideas at that moment. That's why you forget words that maybe after that you remember. Yeah, that was the word I was looking for, right? It happens all the time. It happens even to me. Okay, but it's just because we are in another place, maybe, and we have a lot of ideas. We have to work on that, practice more, and you will find a better way to make the explanation correctly and with a lot of vocabulary, but you're improving, so that's good. Okay.
You teacher, love you.
Okay, love you too. Vale, take care and tell me what happens tomorrow with your test. I don't know if they're gonna give you the answer at the same time, but I hope you don't have COVID. Okay, and I hope you feel better. If you have,
Okay.
just take care, as you know. Okay, and I isolate a little bit from your family. Okay.
Okay, I will tell you what happened tomorrow and hope you have a good weekend and
You
see
too.
you.
See you on Monday. Take care.
Bye.
Bye bye. Bye bye.